From CBS 47 and Fox 30, you're watching This Week in the 904.
Well, maybe you're waking up this morning with the spring sniffles and you're asking yourself, is it a cold or is it allergies? And we hope that we can help you understand some of those symptoms today. Thanks for joining us for This Week in the 904. I'm your host this week, Chandler Morgan. Joining me today is Dr. Paul Radabaugh from the Jacksonville Sinus and Nasal Institute. Paul, thanks for being here.
Absolutely. Happy to be here.
Yeah, it's a busy time for you right now.
Pollen is falling.
Yes.
So it is a very busy time for us, but an exciting time to try and help patients out. So
yeah, and we have a partnership with you all for the First Alert Allergy Tracker with the Jacksonville Sinus and Nasal Institute. Absolutely. It's fascinating the tech that you guys have implemented with us. Can you talk about it a little bit?
A little bit, for sure. You know, when we look at pollen counting, this has been going on for, 50, 70 years. The hardest part has always been the labor, and it's a hugely labor-intensive process. Being able to look under a microscope, looking at pollen granules all day long, and you really don't get kind of very accurate results on, within a minute, within 2 minutes or things like that. It's usually over the day what has gone on. And because of that labor-intensive process, it was always difficult to try and duplicate or be able to understand where are we right now. And kudos to the Pollen Sense group and being able to create really an interesting technology where we are able to use a camera basically and detect basically on little pollen cartridges every 2 minutes, taking pictures of what is in our air and what we are breathing in each and every every minute that's there. And when we go forward with that, the camera itself is able to use AI technology to kind of look of what it's seeing and saying, well, what pollen granules do these most resemble? Is this a pine pollen particle? Is this an oak pollen particle? And it allows us in real time to kind of know what's going on today, what's going on in the next 20 minutes, 30 minutes, as opposed to understanding what's gone on over the week or what we think maybe our best guess of what's happening based on other places that are doing pollen counting.
And it gives you a lot of good data. That way you can try and map out and prepare maybe for what's going on. What are you seeing the most as far as pollen counts right now?
Well, right now we're kind of right in the peak of pine pollen. And we've kind of gone through a little bit of cedar. And the last kind of big wave that everybody kind of gets kind of cringes about is oak pollen. And that's going to be coming up. It just started this week. And I think we'll begin to continue to see that as it starts to go on the rise, usually in mid to late February and on into March.
Right, so February, March, there's a lot of transition that happens within that time. Speaking of what you're seeing right now, I know that you're very busy constantly in your office seeing people in and out, especially this time of year.
Yes.
What are you seeing on your side as far as people coming in and saying, hey, I've got some issues, I've got some symptoms?
Well, it's humbling at times because I see a lot of patients with chronic inflammatory diseases, sinus disease and things like that. And this is the time where we're getting a lot of patients back. I'm worse. I've had an exacerbation of my chronic disease. And because there is so much more pollen and things like that that they're reacting to, we're having exacerbations of their chronic illness right now. And the other things that we're seeing, always the nasal drainage, worsening nasal congestion, like what is going on? Why is it always this time of year that I'm getting these symptoms, and what can I do to better improve those?
Is Jacksonville an area that you tend to see more issues that people experience? Is there kind of a relativity to it?
Well, I mean, there is a little bit of a cost of living paradise. We have a beautiful place that we live here in the southeast, and because of that, there are a lot of things that grow, specifically pine, oak trees, and things like that have a lot of wind-driven pollen that can really, exacerbate these symptoms. Most of the top Jacksonville has ranged in the top 20 usually of worst cities from allergy and asthma troubles, mainly because of that. And so there are a lot of things in Jacksonville specifically. Number one is we do have such an earlier spring here. And depending, if you talk to our people and the weather side, that depending on how cold the weather is, may push one way or another as to when this pollen is going to drop. How much rain we're having, all of those things make a big difference. And so we see it earlier in Jacksonville because we do start to warm up faster. But the other things that happen with Jacksonville, number one, we have a lot of wind. Number two, we don't have a lot of big structures that can block this pollen. So these pollen granules can travel a lot further than somewhere, say, mountainous or in other areas such as that.
That's so interesting when you think about how Jacksonville's built, and it's obviously very large.
Yes.
I never knew that about how the building structures can really play a big role in that. We've recently experienced a lot of wildfires or brush fires and things like that. Does that throw in a mix of another allergen for people?
It does. I wouldn't say an allergen, but definitely an irritant. And so, part of this, and that's one of the things when we talk about allergy to begin with, is the patient actually creating a histamine response to what's in the air, or is there just so much stuff in the air that it's kind of irritating to the nasal linings, and that's creating symptoms? And so kind of trying to hash out between one or the other, it all lumps into this time of year, and it gets to be a little bit harder to kind of tease out of how to make patients feel better.
Some people say that they feel like their allergies maybe compound year after year. Maybe they say, oh, it's so much worse for me that year. I mean, is there any truth to that? I guess maybe it's subjective, but as far as what you see.
It's hard to know. Everybody is very different in their symptoms, and yes, sometimes year over year, if left untreated, inflammation will worsen. But it's hard to know. You're kind of going through the trenches now, and you're like, oh my God, this is the worst year ever, and then you don't really remember where it was the year before. We do know overall, if you look at age and things like that, our ability to create a robust inflammatory response does actually drop as we age. But it's hard to feel that year over year going, okay, the same thing every single year. I continue to have these issues. This has got to be the worst season ever. And eventually, the other shoe drops, and you're like, okay, how can I get help to help improve these symptoms, because what I am doing is just not enough.
Yeah, and that's when you can seek out somebody like yourself or talk about ways to attack that. Coming up in just a moment, we're going to talk about different ways that you can identify, is it allergies or is it a sinus infection, is it a cold? That's ahead in just moments.
From CBS 47 and Fox 30, you're watching This Week in the 904.
Welcome back. We are joined by Dr. Paul Radabaugh with the Jacksonville Nasal and Sinus Institute. Thank you so much, Sinus and Nasal Institute, we should say, for you here. We have a great partnership with you all. We were talking about the First Alert Allergy Tracker, ways to, of course, identify allergens and plan for that.
Absolutely.
But allergies and colds and sinus infections, gosh, it is so hard to tell the difference.
It is, and it's even harder, I would say, where we are here in Jacksonville, because we are still well into cold and flu season, and our pollen season gets to start so early. So there is a lot of interlap and an understanding. Is this something that's a viral infection? Is this a sinus infection? Is this something that is just my allergies that are going out of, just out of cahoots? All of the things can be difficult to kind of parcel out, and sometimes even difficult for providers. So it does take a little bit more of a keen eye and understanding what things we can do to look at those. When do we need to maybe see our doc about some things that just don't add up, and then other times where what else can we do to help manage from an allergy perspective?
What would you say is like the number one symptom for allergies, maybe that you see in a day-to-day for Jacksonville-based people?
Well, we see a lot of nasal congestion, nasal drainage, itchy, watery eyes. Those are some of the ones that really kind of stand out, but they can also be very much a cause from viral illnesses, less the itchy, watery eyes. It's kind of that process that goes through that. And when I look at itchy, watery eyes, what else is going on? What other symptoms am I having that may kind of tilt me one way or another?
And when does it cross into sinus infection territory, when you're saying, hey, I just don't think that this is allergies anymore?
Yeah. Well, and it's very much a spectrum when we start looking at these things, because we know allergic rhinitis leads and is a predisposing factor of sinusitis, because sinusitis itself is also a chronic or acute inflammatory condition of the sinuses. And so some of the hard parts that go with this usually is time. Usually with allergies, these are not going to continue to worsen and exacerbate. They're going to be frustrating as all get out, but they're not going to continue to exacerbate to after 7 to 10 days. Now all of a sudden I'm having discolored nasal drainage that's not getting better. I may be having a double worsening, aka I was getting better, I got hit with something pretty rough, started to get better, but now, man, my symptoms just hurt again, or started to hit me again. Those are some signs that we start noticing is this more than just allergies just out of control? Are we starting to have more of a bacterial sinus infection? And we do know vast majority of sinus infections are viral. And that's that timing that really matters, because antibiotics don't help viral illnesses. And we know that the end stage, or at least the discussion of what starts all this, is inflammation. So doing things to trigger and to optimize inflammation is a much better pathway. And then when we start looking at, man, this has been going on for 7 to 10 days, I'm starting to get discolored drainage, unilateral drainage, all those things start to look a little bit different than just allergies. Some of the other things, especially for, is this a virus or is this allergies? Allergies won't cause fever. It used to be, the discussion of hay fever. It's really there's no fever to this discussion. So if we start to have elevated temperatures, that's when we start worrying about this. Also, muscle aches and really bad fatigue, a little bit more often on the viral side, more so than allergies. Now, you will get some fatigue with allergies. Again, not breathing through your nose is not a fun thing to be.
Right, it's exhausting.
But the discussion, really, those muscle aches, fever, when we start to notice more unilateral symptoms, that's when it's kind of like, do we need to do something different?
What about kids? I mean, is there any indication for kids? It's not fun when the little ones are sick with allergies or sinus infection or cold, but is there any indication that there's symptoms that maybe are more common in kids?
Well, kids add a whole nother level of, foreign body and all these other fun things that can go on for that. So really prolonged symptoms that aren't getting better really need to be seen by a specialist or, and a pediatrician, people who know you and know your family, because everybody kind of has their realm of normal, and going outside of that realm of normal, for how long have you gone outside that realm of normal? And so from pediatric side, kids, they do not like when they are sick. And it is something that, again, looking more at the fever side and understanding better of what other symptoms are going around this. And then who else is in daycare with them? Is there something going on at the same time in their local environment that may be a little bit higher risk of infection?
And something that's so tough for the kids especially is the ears, getting the pressure in the ears. Why is it that is such a connector for allergies?
So it goes always back to that nasty word, which is inflammation. And the ears, in the very back of the nose, there's a structure called the eustachian tube. And so anything that's going on inside the nose that's creating inflammation, the eustachian tube is super, super small. And so any added little bit of inflammation is going to kind of make that harder to open. That eustachian tube helps us to kind of equalize pressure between our outer environment and the kind of what we call the middle ear space. And so, when you swallow, when you're going up in a plane or things like that, you're swallowing, you're opening that eustachian tube, so we're constantly equalizing pressure. Well, when that eustachian tube gets inflamed, it's harder to open it. And so that's really the basis of where we start to have some otologic symptoms that are driven sometimes by allergy. It all goes back down to inflammation and location. The eustachian tube in the back of the nose is still getting that inflammation and the drainage that's going past it and things like that, contributing more to those symptoms that are both from the nose but then also can come from the ears.
What about allergy testing? When do you feel like it's a good time to go ahead and say, should we get a baseline as to what is going on and what's aggravating me?
I think, it really depends on your level of frustration. Where have you been? There are a lot of patients who never come to see me because they've done well on over-the-counter medications and things like that. When we continue to get these similar exacerbations year in and year out throughout, in certain times of the year, or your symptoms just aren't getting improved with appropriate, over-the-counter medications and treatments, then the question always is why? And at what point do we to start saying, well, we don't have to blame it on allergies. Let's make sure it is, and let's figure out exactly what it is. Because long-standing, right now, most of our symptom improvement comes from treating the symptoms, not really treating the disease process or treating the nidus of what's creating this problem. And so when we've done normal things that seem to help most patients or most people, and we're still not giving ourselves, or still not where we want to be. And so that's where it's very much kind of patient-led and patient's decision. Like, well, let's figure this out. because we've been, down a lot of different pathways and we're just not getting where we want to be. Well, let's start figuring out what is the nidus. Is this allergy? Is this something else? Because again, it's really easy to have such a blend of symptoms to be able to understand what exactly is happening. So it just gives us another discussion of, let's be specific. Let's start looking at this very specifically, saying, hey, it is oak pollen that gives me so much of an issue. Well, now I can prepare for that next year because I know where that's happening, as opposed to dog dander that is there all the time because your dog is right there beside you, dust mites, things like that. So being able to understand when are my symptoms happening, and then also how frustrated am I. That's where we start to have that discussion with patients of when it's appropriate and when it's not.
Okay, thank you. Much more coming up in just a moment. Stay with us.
From CBS 47 and Fox 30, you're watching This Week in the 904.
Welcome back. We are talking all things allergies with Dr. Paul Radabaugh here. And we are talking about now a different way, to treat different things.
Yes.
There's 3 kind of categories. Can you lay out what those are for us?
Yeah, well, especially in the over-the-counter, things that are available from the pharmacy, you don't necessarily need a prescription for. They kind of come in different levels of treatment options. You have antihistamines, and those are like your Allegras and your Zyrtex, things that you're going to take by mouth in about every 24 hours that you'll be able to use. Those are treated basically by mouth, and they're blocking the main source of what we feel is creating so much of this inflammation is that histamine response. And they're very specific. They're just treating antihistamines, they're just treating histamines. And when that process is going on, it's trying to block that reaction throughout your body so that hopefully you have improvement in symptoms. They also come in topical form, nasal antihistamine sprays that are also very helpful through this. Some of the negatives with antihistamines, there are non-drowsy forms of them, but especially like your Benadryls and things like that you will have a little bit of lingering sedation or just feeling tired and more groggy sometimes. And even on the non-sedating antihistamines, some patients still struggle with that.
Nasal sprays, big topic about how long you can use those.
Yes,
there are certain ones that maybe you need to stay away from. And then, saline is a whole different topic.
Yes.
Too.
And if one thing that we can get through this process is that, or this discussion with me and you today is saline is awesome. Isotonic, normal saline, and saline in irrigation form, or just high volume, low pressure, really helps because it does 2 specific things. Number one, it helps to clear the mucus that's causing so much frustration and some of the other areas of irritation inside your nose. But the other thing is it's actually decreasing time on contact. So the only way for an allergen to create a histamine response, it's got to land on your nasal mucosa. It's got to start to create an inflammatory response. And that all takes time. If I'm giving your nose a shower once to twice a day, I'm decreasing the time when those allergens are sitting there and creating that inflammatory response. So I can't say enough, saltwater flushes, my kids do these, they can get through it. I always tell people, when I do the shame of, well, my kids can do this, I'm sure you can do this. Like, there's a lot of concerns of how do I do this? And there are a lot of ways, even on our website, jackscience.com, we actually have a kind of a step-by-step of how to do the saltwater flush, because it seems a little ominous at the beginning. There are videos that kind of help walk you through this process. I'll tend to give my patients a little video so they can say, hey, use this on your phone right when you're doing it, because I can tell you how to do it, you're not going to remember. So here's a way to have something that you can have as a resource whenever that process is happening, whenever you need to do that flush. Back to the decongestants.
Yeah.
Those are the ones that are great, and nothing works as quickly as the decongestant. And that's why it's so sometimes addicting for patients, because they get that immediate relief of nasal congestion. The problem is how our body responds to those decongestants, and not just topical. We talk about oxymetazoline, neosynephrine. Those can be used very judiciously, maybe 1 to 2 days at the most. I don't want to go any further than that, because our body actually starts to create a tolerance to these medications, and it therefore creates more need for these medications to get the same effect, and then more need for the same effect. And you can tend to see this positive feedback mechanism. People will get miserable because there's nothing else that they can do, and they've actually created such a large inflammatory process inside their nose that they have some issues trying to get off of that.
Yeah, that's tough too, because then, you're seeing relief.
Yes.
And then at what point is it ineffective, maybe? Is there any
Correct.
tolerance that gets built up
Absolutely.
with that?
It's more of a tolerance. It's how your body responds to the use of that topical decongestant. It creates more receptors. And so what happens is you kind of upregulate these same receptors that you're trying to block. And now when they get more and more unregulated, more and more blood flow is going into the nasal cavity, and that's really where that extra added congestion keeps happening. And so that's where we end up going down the bad slippery slope of continuing to use those medications. And there are great ways to be able to come off of it. It does take time. I always tell patients, it will get worse before it gets better, but hold steady from what we're doing, because we can get you in a better spot. It just takes time and your knowledge of what's going to come down the pipeline to work through it. Oral decongestants are a very similar process where they're trying to do a similar pathway of decreasing inflammation, not really inflammation, but just decreasing blood flow inside the nose. But there are a lot of side effects that come with that. Your cardiologist or your primary care doctor will not like your blood pressure over time, and they're not really good medications to use long term because of those side effects.
Well, Dr. Radabaugh, thank you so much for being here with
Absolutely.
us today. We appreciate it. Wealth of knowledge as you, of course, work through allergy season. You can find more conversations on This Week in the 904 on the tab on actionnewsjax.com.
Thanks for watching This Week in the 904.